Children in our fast-paced society are under pressure to perform at high standards, both at school and in their homes. That kind of stress often reveals the symptoms of behavioral and learning problems, problems that create anxieties for busy parents and teachers about how to address these issues.
He had, or has, attention deficit disorder, learning disability. He was also diagnosed with anxiety and depression.
He seemed unfocused. It was very difficult for him to do any projects. For instance, I would be reading a book to Tony and he would just get up and leave. And so my next door neighbor, who's a teacher, thought that he could have ADD and that we should go get him tested.
The first diagnosis for many behavioral problems is attention deficit disorder, or ADD for short, or its companion disorder that involves hyperactivity, called ADHD. In our era of the quick fix, the common treatment for this lack of focus and acting out is now a pill. Stimulant drug therapy. Now, all these drugs carry serious warnings, and parents need to confront important questions when relying on drugs for the solution.
He was on Ritalin for about a year. He didn't seem to have too many negative side effects, but he did have a low appetite and trouble falling asleep. And then the Concerta was the one where he had severe side effects, or he wasn't falling asleep till 10:30 at night, was hardly eating anything, and was wasting away. The medication helped initially, and then it pretty much did nothing.
I can't imagine starting a child out 8 and 9 years old and having them stay on that for a lifetime. If there's another alternative, then I want to know what that is.
There are programs that deal with the symptoms of ADD with non-drug therapies. One very successful approach to ADD and learning disorders can be found here at the Attention and Achievement Center in Walnut Creek, California. Founder and president Dr. Ali Hashemian says it's time to look beyond drugs.
Every scientific paper and evidence we have shows that medications are not the answer, certainly do not come without negative side effects, and they have no sustained long-term results. So at best, medication is the band-aid. The unique aspect of our profession, our center, is that we have a solution as opposed to temporary fixes that medication offers for ADD and HD. And more importantly, our results are sustained over time even after treatment stops, which usually lasts only a few months. Unlike medication, which the person must continue taking every day for life if they want to have the benefits. We have the team of experts, neurologists, psychologists, speech pathologists, all of these people who have been doing this for years, bringing different components of experience so we can treat the whole child and the family in order to have structure, have improved abilities, have the memory, everything that the child needs to focus.
The center's broad array of professionals brings years of experience to the diagnosis and treatment on a case-by-case basis.
My name is Jay Gunkelman. I'm a neuroscientist, and I work specializing in the computer analysis of the brain's electrical activity. I've been in this field since 1972.
My name is Dr. Julian Kaufman. I'm a licensed clinical psychologist, and I do collaborative work with the Attention and Achievement Center.
My name is Greg Alter. I'm a licensed psychologist in the state of California. I've been in practice since 1980 and been doing biofeedback for that entire time. Recently, the focus of my work became child advocacy, working with children who have attention problems and learning disabilities.
My name is Dr. Sharon Bailey, and I have spent the last 30 years working with probation teenagers. I'm the director of the educational services. The program deals a lot with neurofeedback and cognitive skills, and I deal mostly with gaps in education, kids that come in and they're learning all these skills on how to learn.
I work through the Achievement Center doing evaluations of families and children, and I participate in the evaluation process, the assessment process.
My name is Joyce Arliano. I'm a speech-language pathologist. and I've been a speech-language pathologist for the last 6 years.
The center uses its staff of experts to assess a child's needs in every area. Sometimes they find ADD is not the problem. The first and most important step for the center is to do a comprehensive assessment and diagnosis. All of the assessments at the center are non-invasive. That means the child is not exposed to radiation or magnetic fields. The tests measure the underlying electrical activity produced by neurons in the brain. The child simply wears a cap with sensors embedded in it, and computers make a recording of the activity in different locations in the brain. The results are analyzed, and a neurofeedback therapy designed to address the inefficient areas of the brain.
Once we have the electrode cap on a child's head and they've recorded the brain's electrical activity, those little wiggly lines, we then process it through databases and compare those actual patient values to the database. And it can show us where in the brain activity is deviating from normal. This is the raw wiggly line EEG on this one child. This can be processed through the computer algorithms and turned into colored images. This is a neutral 0 point, the green. This is an excess in the red. This is deficit in the blue. Here is the theta in the front of the head during task. That's associated with the ADD. The psychiatry questionnaire or office visit does not identify the underlying physical mechanism. It just identifies the behavior. The QEEG data that we end up analyzing does allow us insight into the actual mechanisms underlying those behaviors. And that allows us to identify the therapy, not just the diagnosis.
Parents strongly support the comprehensive and complete diagnosis.
I was a special ed teacher before I had kids, and to me the diagnosis was first and foremost the most important thing, because I wanted to know exactly what was wrong with him, and the doctors and the schools, they don't have the ability to tell you that. And so what attracted me to the center was the complete medical screening.
The brain maps, it was like a scientific proof that showed my husband and I that there was something there and that it wasn't just a questionnaire. I wasn't comfortable with just circling A or B on a piece of paper. I needed something more than that.
Often, the center staff discovers an earlier diagnosis had been too hasty and missed real clues to the child's problems. A correct diagnosis can lead to resolution of the ADD symptoms.
I guess it's the EEG, the initial one that the neurologist reads. They revealed not only his attention deficit, so that I had confirmation that that was truly his diagnosis. It also said he had a learning disability, and it also said that he had anxiety and depression, which was new. I had never heard that before.
We came here and then they did all of the testing on Tony, and the actual diagnosis was a little bit different from when we were at his doctor. With ADHD, so they throw the H in, which means hyperactivity, and also Asperger's syndrome, which is something I didn't know anything about. But now that we've been here, I definitely know a lot about it, and we are definitely dealing with it well as a family.
Once the right diagnosis is in place, the center develops a neurofeedback training program to address those areas of concern in the brain. And what is neurofeedback? Well, it's a process to train the brain to improve focus, attention, and concentration.
The neurofeedback is just an operant conditioning training technique. Kids, for instance, don't really like bar graphs or simple displays. So the information is coded into a computer game or coded so that it starts and stops videos, things that kids are interested in. So they, at that point, actually work hard to try and make the videos work. And their brain ends up learning through a process of trial and error.
For example, EEG neurofeedback has been around for many, many years, some 30 years plus, and there's a lot of clinical data that it shows is effective, is safe, and it's fun. Unlike medication, there's no side effect to it. It does exercise the brain neurons, very much like going to a gymnasium. If you want to work out, you go to a gym, you lift weight or do a number of different exercises, and that exercises a certain part of your body. Research has shown us that the brain is very plastic. That means it's very capable, in fact more so than any muscle cells in your body. And if you can teach the brain how to exercise certain functions, certain area of the brain, that would yield a significant improvement in the cognitive abilities, whether it's regulating focus, whether it's improving reading skills, whether it's improving attentional duration or impulse control issues, or improving memory. You can target each area that you want to enhance, and by exercising it, you will improve those skills.